Well, Professor, the question of arthritis, what are the treatments for arthritis?
Again, I want to divide this treatment into two parts. The first part is actually general treatment. When you have arthritis, usually you have pain, swelling, and redness. So in all kinds of arthritis, you have this general treatment. And it includes things like painkillers, like Panadol, or what we call non-steroidal anti-inflammatory drugs, like Celebrex and Arcoxia. Now all these are actually non-specific. They do not treat the arthritis itself, they just treat the symptoms of the disease, which is important. And then you have to focus on specific treatment of the disease itself. That again depends on what kind of arthritis you're talking about. Now in osteoarthritis, actually there's at the moment no specific treatment. But I think all of you have heard about supplements like glucosamine. I think everybody with arthritis takes glucosamine. But unfortunately, glucosamine is known to affect only one kind of arthritis, and that is osteoarthritis. There's no evidence to show that glucosamine affects other kinds of arthritis. Now, in osteoarthritis, when you take the supplement glucosamine, you must know how to take the supplement. You see, when you take glucosamine, the glucosamine must be taken every day. And the minimum dosage a day is 1,500 milligrams a day. Now, there are many kinds of glucosamine on the market. And there are some glucosamine sulfate, there's some glucosamine hydrochloride, there's some crystalline glucosamine, there's some amorphous glucosamine. Now the only glucosamine that is shown to be effective in scientific studies is actually glucosamine sulfate, the crystalline form. So if you don't take the correct form, if you don't take the correct dosage, then it's useless. So again, if you take supplements, I think it's best to discuss with the doctor which supplements you should take.
What you're saying is that there are specific treatments for different types of arthritis.
Yes. When we talk about, as I said, we'll be mentioning only the big three. Right? For example, in gout, there are very good drugs for the treatment of gout. And that drugs actually lower the uric acid. But you need to monitor the uric acid levels, say, every month or every 3 months, to make sure that the uric acid level is coming down. For rheumatoid arthritis, there are now very effective drugs for the treatment of rheumatoid arthritis, including a group of drugs called biologic agents. These biologic agents are actually chemically engineered drugs in the laboratory. They have to be given by injections, but they are very effective. The problem with all these specific treatment is that you cannot stop the treatment. Once you stop the treatment, after a couple of months, the disease relapses. You can reduce the dosage, but usually you cannot stop.